All right.
There we go.
Today we have Lorre Mueller. And Lorre, I consider Lorre somebody who's actually changed my life with her equine dissection class. She has helped us advance the iridology research we were doing. We couldn't have actually done it without her and some other dissection teams. We partnered with some other people in Tasmania too. But to
Wow.
actually go and do it hands-on, you guys, I cannot tell you what it's like to do a hands-on dissection. I was vegan, so I had some fears about going. I was nauseous going there. Cheyenne's laughing. I can see her, and I was praying my way through it, but it was so fascinating and so educational. And every time we confirmed an iris mark to whatever Lorre was dissecting, I was done. I was like, oh, let's rip it apart. And what we did learn is some things were very, very accurate, and some things might have just been struggling organs or compensating situations that didn't really show up in the dissections, but the horse was expressing it in the iris just because there was so many malfunctions happening. So I've gotten to do 3 in person with you because I missed the one in Texas, and all of them were different and all of them were educational. And Lorre, you learned from Yannick Vlugen from the Vlugen Institute. You're an equine osteopath, plus you are a Masterson trained instructor that you don't really do anymore.
No.
So you travel all like fall to early spring all over the US doing these dissections for people.
Yes.
And
And
it,
this year has really gone off the charts. Like they've just built and built and built each year. And so I think the more people that come and then people ask, like, how can I host one of these? And it has just grown and grown. And then honestly, without Ivana Ruddock coming here anymore and without Sharon doing it as much, either Sharon May Davis, there was kind of a need for it. And I kind of just stepped into a gap there. And I think with COVID and everything too, it just happened. It
and you
was
guys,
pretty organic.
if you are a body worker, if you are a farrier, if you're a horse trainer, if you're a horse pro in any level, you should do this.
Yes, I absolutely agree.
Yeah, it will build awareness. It will change the way you think about animals. And um I even saddle fitters, I just want to shake them sometimes and go, oh my gosh, do you even know what's happening internal? um it's just mind-blowing. And there's still, every time you do it, it's a new thing. Like
Yeah.
it starts all over again. You just think, okay, I think I have this down, and then we do another horse. And these aren't healthy horses, you guys. These aren't like, we're not dissecting horses that shouldn't be dissected. We're
Yeah.
dissecting horses that are struggling, and they get to give back to us one last time, and it's a lasting legacy of education. So it's,
That's a beautiful way to put it. It really is. I mean, because they are truly the teacher. I'm just the narrator. They're the teacher.
well, I'll tell
And
you what,
so
I'll never use anything but Viva towels again.
aren't they the best?
They are the best. So if you ever go to one of these dissections, come prepared, bring your own Viva towels just as a gift to Lorre, because she's obsessed with them because they're cloth-like. And
Yeah,
now
they work good.
they work really, really good. And so every time I buy Viva, I think of you, Lorre, like
Oh,
the Viva towel contribution to America.
that's funny.
So how, because of Yannick's class, explain who Yannick is.
Yeah. So Yannick Vlugen runs the Vlugen Institute. He is an osteopath, a human osteopath that developed a program for horses. And that's what he teaches is just a horse. But well, actually, they do a dog program now too. So you can be certified in either. I don't believe that their dog program is open to everybody. I think it's a continuing ed course for equine osteopaths. because
Oh,
he
no,
doesn't want to have to teach all of the physiology and all of that stuff all over again. So if you do it as a horse EDO, then you can become a dog CDO. And so, but that's where I did my first dissections, was at the Vlugen. We did 4 as a part of my training. And I'll tell you what, like the first one I did, I stood in the back of the crowd. I didn't want to touch anything. I was kind of heebie-jeebie. I was not. I'm an animal person. I was just like, oh my God, I don't think I can do this. And then my brain kind of kicked in and said, if you don't get up there and start touching things and feeling things and moving things and seeing how things attach and see where everything is, you're going to miss out on a whole aspect of this training and this education that is invaluable. And so I just sucked it up and got up there and did it. And as soon as I got up to the front, Yannick just barked right at me like, go dissect the TMJ. And I was like, what? I had never had a scalpel in my hand in my life. Well, maybe dissecting a frog in 7th grade or
I
something.
know exactly, right? The formaldehyde.
Yeah.
It's so gross.
So, I just kind of jumped right into it. And then I just had to learn more, like, because we did the dissections at the Vlugen for very specific reasons. Like we wanted to look at joints, we wanted to look at organ attachments, we wanted to, it wasn't really about the anatomy, like seeing the muscles and the fascia and all the attachments with that. And so I wanted to see it on that aspect and go through layer by layer. So a few friend of mine, several friends from the Vlugen, we would just get together a couple times a year and do a private one by ourselves and just explore and learn. And everybody seemed to ask me all the questions about, because I'm a kind of anatomy geek. I love the anatomy. And so they would ask me questions constantly. And finally, one of them was like, you need to go teach this stuff. Like, you just need to start doing this. And I said, oh, I don't know if I want to do this for a living. But that's kind of how it unfolded. Was like I said before, with COVID and everything, and with Ivana not coming and Sharon being very limited on her dissections, there was just a need for it. And so, I did 1 or 2 a year, and then it became like I did 4. And then last year I did 8, I
I was
think.
gonna say, yeah.
And then this year, I think I have 18, I think.
Oh my gosh.
I'd have to count.
How do you get all your stuff there? I mean, you're like a TSA nightmare with all these
Yeah.
stuff. Oh my God.
So my knives and my some lights, stuff like that go with me on the plane. The rest I ship.
How do you
And
get
Amazon's my
on
friend.
the plane? Like,
They go in my bag and they get checked. I mean,
oh, okay, good.
yeah, I don't carry them on the plane. No, I don't think I would get on.
You wouldn't. There's no
No,
way.
no, they just get checked.
I
Yeah,
get
but I'm sure that they look in that bag and they go, what the heck? What's going on? I should leave them funny notes too. Like that would be funny.
that would be funny. And plus some bones. Because
Yeah,
you ship bones too, right?
I do. I've actually started to travel. Sometimes when I go places, some of the people hosting actually have some bones. So I can usually get away with it, not having to travel with bones, but I go quite a few places that I do need them. So I have a little mini that I can travel with. It doesn't, he's, he does the trick. His name is Nacho.
I haven't seen Nacho.
You haven't seen, he was there in California.
Was he?
Yeah, yeah.
Oh,
Um,
I have seen
I
Nacho.
think
I've seen Nacho's sternum.
I think he was. And so I'll bring him, or I'll just bring very specific bones. It's easier to bring him because I really need the pelvis and I really need the skull. And those you can't pack a full-size horse pelvis and skull. It just doesn't travel well.
Yeah.
So Nachos does the trick. He's a good helper.
So
But
the thing that I was most shocked about is the pancreas.
you have been very shocked with that. Yeah, it's kind of a weird organ. Like it's so delicate, and you have to be very careful if you want to see the whole thing. Like it doesn't come out very easily. It once it's exposed to the air and stuff, it just really kind of falls apart.
Yeah. Why
Yeah,
is that? Like that doesn't sound healthy. How could the pancreas work and be that
yeah.
fragile? I don't
And
cannot
and the
wrap my head around.
pancreas is a he's a workhorse. That organ is, I mean, that's our insulin, that's our digestive enzymes. He and that's our sodium bicarbonate too to help tamp down the pH in our gut. So he does a lot of stuff.
Hormones, all the hormone
Yeah.
secretion.
Yep.
It's so you guys every
But the only one you've seen that came out whole was one that was
disease
diseased.
and it came out gray, flat,
Yeah.
hard,
Hard. I
fibrous.
mean, as soon as the veterinarian looked at it, he was like, "Oh, this doesn't look good,"
And
because
it
he knew too.
and it's weird because that one dissection was spring in Missouri. Um,
Yes.
and spring was covered in this yellow fat, this bright, toxic yellow fat. She was super oily, but she was not a fat horse.
No, not at all.
And that just
She
blew me
didn't look
away.
like a fat horse.
But
So
she,
we have to premise all of this because that's where we met.
yes,
And so Poppy reached out to me, a few months before the dissection, and she said, she explained who she was and if I knew anything about iridology, and I did. And she said she would really love to be able to look at the horse the day before and see if we could make some connections. And I was like, yeah, sure, let's do it. And so I had no idea what I was in for. Um, and it was so amazing because I was shocked at how many connections we made.
right. We know a lot of the same people. And I know a lot of your Yannick Flugen
Yeah.
friends. And so
Yep.
I toyed with going to the Blugen Institute. I was married at the time, and my husband was like, no, you're not going there. And I'm kind of grateful that I didn't.
Yeah.
Yeah, my life would have taken
Um,
a whole different course.
yeah. But it was just uncanny to have you guys write your reports and then just follow it through all weekend long and see the connections that we made. It was just, because it's hard because you guys haven't really perfected it. Like that's what you're trying to do by doing all this is to really perfect those markers. And so you would give me things like, I don't know, diaphragmatic flexure. And I'm like, well, what does that mean? Like that could be anything. It could be inside the diaphragmatic flexure. It could be around the diaphragmatic flexure. It could be in the vicinity of it. Like it could be in the omentum. And that's what in that horse in spring,
It
do
was
you remember? That's what it turned out was omentum at the diaphragmatic flexure of
yeah.
the intestines.
So you guys,
And
it was a lipoma that had calcified. And so it was, and we got the marker
and yeah,
and we nailed that. So
yep,
there's a confusing thing since Lori's class is what we thought was lymphatic could actually be lipoma. So we're trying to like dial down now. Is it a lipoma or is it lymphatic? The body recognizes those two markers as almost identical, but the density is what's different.
well, and I wonder too, though, because that omentum did its job. Because you remember, I've explained that omentum is like a spider web in that abdomen that it catches stuff that shouldn't be there. And you can't, like, your mind goes, well, what's there that shouldn't be there? Like, how can anything get into a closed system? But it does. And but her body, it was the fat. Like she did not like the fat. And so that omentum was capturing little hard bits of fat and then starting to wall it off, kind of like a pearl, like a piece of sand in an oyster. It just gets walled off and becomes a pearl. And that's what we found all over that omentum.
They were like
And the
golf balls. I mean, not
yeah,
quite as big, but they
yeah,
were hard.
yeah.
How
And then you
painful.
remember the one we found attached to her pelvis?
Oh, yeah.
And you guys found, I think it was pubic symphysis or something like that.
We're
And
not
there was a
vaccinated.
huge one like that attached to her pelvic bone.
That's right. Amazing.
So
She was
yeah,
the best introductory horse because she
she
had
really
so much
was.
pathology.
Yep.
Yeah.
I mean, with the the pancreas and all of the I call them pearls that we found in her omentum and stuff and in her body. And yeah, she had a lot of stuff.
Yeah. It was impressive. Also, what I'm fascinated by is the elbows. Every single horse that I
Oh,
attended had
yeah.
elbow pathology or degeneration. They had some
Yep.
lesions, and nobody talks.
And I know, well, Sharon May Davis does, and she's written a couple of papers on it, um, trying to, explain that to people and why. And so if you're interested, you could, anybody could look those up. And but yeah, you're right. Almost every single horse we open their elbows, joints. There's definitely some degeneration there.
And do
I
you
mean,
think
the
that
last one that Chey was at here in Texas, I mean, that horse was 6 years old, and I don't think we opened a single joint that didn't have stuff,
that's
some
all?
kind of synovitis or bony changes or, you know, really dark synovial fluid, and it was bad. So
What do you think was the cause of that? Like, do you get
I
to
wonder if he
understand it?
had, I wonder if he had some kind of autoimmune something going on for him to be that uncomfortable that young. And then we also in Utah in April, um, we had a 4-year-old thoroughbred that oh, that was heartbreaking. She was really dangerous, and that's why she had been donated. And dangerous by herself, like not with a rider, not with a, like she could be moving in the pasture and it would, like it was like she got a zinger and she would rear up and flip over backwards, and she was really dangerous.
What was
And
it?
then the
What did
stuff,
you guys
oh
find?
my God, we found broken withers that had formed down on the side of the dorsal process, and they were almost like these hooks. And then the longissimus dorsi was running under these hooks.
Oh my
And
God,
so when it would contract, like it would dig into the muscle, I think. And she just couldn't take that pain.
that's insane.
Um,
Horses are honest.
yeah,
And so when I used to be a horse trainer, I did the quarter horse and paint circuits. I traveled to the world shows and the Congress. And when I would see horses like be bad, I was always the one to be their voice and go, look, there's got
yeah,
a legitimate reason. He's good on the ground. He's good most of the time. When you have a horse that's really retaliating, it's a desperate cry for help. And so
yep,
you doing what you do helps educate all of us in the
yes.
validity of that, because how it would be hard for a vet to figure that out. And obviously, a vet didn't figure it out because the horse ended up on your.
Yeah, I think the only way like they would have seen that is maybe with an MRI or something, because they were right on the side. They might have seen it on an X-ray. If they had taken it at the right angle, they might have seen it.
Now, Lori,
Um,
because you're a body worker, could you visually see the distortion in the withers?
I looked at her the day before and I did not. It was down so far underneath the muscle. I didn't feel that.
And you're an excellent body worker. Like, if anybody would see anything, I would trust you to.
Yeah, I mean, when I tested them, they didn't move. They were very immobile, but I didn't feel those broken parts. They were pretty deep. And then we found ribs that were really misshapen, like 16, 17, and 18 on the right side. They just had the weirdest shape to them. They didn't look like they had been broken and and healed. They just looked like they were formed
Deformation.
that way.
Yeah.
Yeah. So I
So
think
that
that was probably a little uncomfortable too. And um,
Do you think that's
Yeah,
from like calcium deficiencies? Do you know?
I don't. I
I always
don't.
wonder about that. I I have a senior horse here whose I managed the stallion. The brother had tons of bone disorders um like splints and lots of abnormalities, like was super, super fragile, but a fancy mover, went to the Congress, won a lot. So the colt that I got was given to me because he was born a wobbler. And so the mare more than likely had EPM. He was an EPM bull with the the secondary wobbler issue. But it also makes me wonder about the nutrition value
Yeah.
to that. I don't think we know nutrition well enough.
No, I don't think so either.
Yeah.
They're doing so my other gig too, besides doing all this is, being a part of Dr. Hostler's vet compendium.
Oh yeah.
And so they're doing a nutrition one, I think. I'm not sure it's going to be a community gathering and they don't put those on the calendar until the month that they're in. So they're not on there ahead of time like the webinars are. But I want to say it's coming up either in November or December. But they have a couple really good nutritionists that are assertive. Both of them, I believe, are from Canada.
Interesting. Is
So
that Sarah? Sarah Griffith?
no, I don't believe so. I forget their names. It's still in the works to get it all
Okay.
together and stuff because they work on those a couple months ahead of time. But that name doesn't sound familiar.
Okay. Yeah.
Um,
We have some Canadian members in here, and
yeah.
some of them are equine nutrition advocates. But I know Claire Thunes, who used to be in California, she's now in Arizona, was UC Davis's premier nutritionist, and she seems to be the United States go-to in this area.
I think that area, and then my other big gripe, I think, is endocrinology. Like we have human endocrinologists. I don't know why we don't have people, veterinarians specializing in endocrinology, because equine metabolic syndrome is such a epidemic. And so if we don't understand how the hormones function, how are we going to solve these problems?
Right.
It seems and I think even in the human world, like doctors don't even understand the endocrine system unless they specialize. They truly don't get it.
Yeah,
They
no,
just
it's
don't get it.
frightening. It's frightening. And we've gotten to see some abnormal thyroids.
Yep,
So
absolutely.
that's been fun for me. I'm like,
Yep,
yes, there you go. And
yep.
adrenal glands. We never do the brain. So I never know
Well, I have.
you
You
have.
haven't been there. Yep.
And
So
the
that's just
crazy,
a lot of work because brains and spinal cords break down really fast. And so if you don't do it fairly quickly, the brain will be mush. And so, um, when you have to do that first, you have to take a lot of the muscles off that. So you have to get some lead up to it to be able to then do the skull. I've done it a couple times. I might do it at the one here at my house in January.
oh,
I might,
okay.
because I have the equipment and stuff here. It's hard to do when I'm traveling.
Yeah.
Um, And then we have discovered that, putting the horses down with the lidocaine has been a bonus for actually preserving the brain because they put the lidocaine in the brainstem. And so that we just kind of discovered it by accident that we did that horse's brain, and it was so firm and pretty. And the vet that was doing the dissection with us, him and I were just like, "Do you think this was the lidocaine?" And he thought so for sure. And
So
he
I
did a
have a
beautiful
comment.
job.
I have a comment about that because the Tomosi horse you guys did in Texas was lidocaine.
No,
No? Oh, that was
no,
my theory. So because we have tracked the iris like 8 hours, 24 hours,
yeah,
48 hours post-mortem, the iris changes. And
yeah. No,
didn't
he was shot.
So I
So it's
didn't.
a pretty pretty instantaneous.
So
So
I was wondering if he was euthanized with lidocaine and it preserved the nerve
some of
quality.
the nerve function, yeah, maybe, I don't know.
Yeah, but he
Could
was
be.
shot. And you
Yeah.
guys, they do normally shoot them, so you're not putting your hands, you wear gloves, but you're not being
Yep.
exposed to any euthanasia drug. So,
Yeah.
and you don't
And
miss
my
that.
biggest concern with that too is I just worry about other animals. It
In the meat.
depends on how they're gonna dispose of the meat and the carcass and stuff. And so where does that end up? And can the animals get into it? And I just worry about all that stuff because a lot of people that host these dissections actually want the skeleton. And so we have to be very careful of that because if animals were to get into it and try to dig it up, then,
That
you
would
could
be
kill animals with that.
well.
We actually had a really bad at the Logan one of the nights we were doing a dissection because we would do it after class. You would have class all day. You get done at 5 o'clock in the afternoon and you were there until midnight doing a dissection.
Wow.
And they always put the horse down with euthanasia solution. And there was a dog that was there and nobody realized the dog was licking the blood up and the dog went into convulsions and luckily the veterinarian that was there and Yannick acted quickly and they just started pouring chlorella down this dog's throat to soak up the euthanasia solution in its body and in its stomach and stuff. And the dog made it, but that just stayed with me. I was like, I don't want that to happen to anybody's. Not that there should be animals out at a dissection, but
Right. No,
most
but
of
there
these
was
happen on farms and
barn
it
cat.
could be. Yeah.
Yeah.
And like when I do it here in Texas, I live on a big place, and so we take it way down behind our pond, and we feed the coyotes and the buzzards. So we dispose of all the meat and the organs and stuff. And it
I know.
ashes to ashes kind of thing.
Yeah, in this community, a lot of them are raw feeders for their dogs. So
Yep.
I would be open to doing horse meat that was dissected,
If it had any of that solution in it, you cannot.
but if it
So
had
if they're
silica
shot,
or EPM. So
yeah,
I don't want to feed an EPM infected horse to my dog because that's
yeah,
cystic fayeri is
yeah,
is a possible, but the NK9M and the NHJC might be
yeah.
reactive. So that just scares the heck out of me. You can't freeze
You're
that.
right. No,
Yeah.
yep. Because I have had a couple people keep the meat.
Yeah.
So
I can't.
um
I couldn't do it just because of the pathogenic possibility because you
yeah,
don't do pathology. We don't know.
no,
We don't know
no.
why
Unless we have a vet there that is willing to do that. Like I've only had that happen in two situations, like the one you did with Spring. It was at a veterinary clinic, so he was able to take some samples for us and send things off. That worked out great. I did one in Michigan in April, and one of the girls in there worked for a vet clinic, so she collected samples and sent them off, and she got a really thorough report back for us because we found some interesting stuff. Like I thought the uterus might have had an infection going on in it, and the spleen was really enlarged. And so, we took some samples and she sent them off, and the histology backed up everything that we were thinking. But I'm not a veterinarian, so I can't say those things. I can take educated guesses. But even when the vets are there, they can't do that without histology either. They can take a very good educated guess. They've seen it before, but until they actually test it, they don't know for certain. So it's nice when you have those situations that you have the veterinarian there or it's at a vet clinic that we get to take part in that because that really solidifies the dissection.
Yeah,
So
I agree. And another fascination for me is how much all the organs weigh. So you said I think it's 300 pounds estimated.
it's about that. Yeah.
They're just
All the organs, all the intestines, everything is around 300 pounds.
can you
So a
imagine?
third of the horse's weight, for the average horse, that's
It's
a lot of weight.
And it's a lot of weight to be running, sliding, turning, jumping with all
Yep.
the organs, like just hopefully not moving around too much. They're packed in there really tight.
Actually, there's some papers out there that talk about this, like that racehorses actually use that function to respirate better. Like they use the force of the organs pushing against their diaphragm to help push the air out so then they can take a big breath, and then that slams up against that diaphragm and helps push all the air out. So
Amazing.
and they said that I think that um they have measured the respiration rate and it matches their hoof stride. Like, yeah, it's in the same gosh, why is my brain not working? The same rhythm.
That's incredible.
So,
That makes sense.
yeah, yeah.
Yeah.
So I mean, because they're such energy efficient creatures, they're going to find the easiest way to do things.
Yeah.
So
That's pretty impressive though that they use the kinetic
the
force.
momentum, yeah,
Yeah.
yep,
Of that
for
just
sure.
flapping and coming back. And it just like
Yep,
puts the horse forward at the same time.
exactly,
That's so interesting.
exactly.
And then also the bladder. Every bladder I've seen has been very, very different.
Yep.
So one was by the rectum, like it was
It should be down. No, it shouldn't have been up near the rectum. It should have been down at the dish of the pelvis.
it was one of the broodmares that had a hard time bowling, so they quit. It was spring, I think, that
Oh, yeah.
they quit
Are
breeding.
you talking about the uterus or are you talking about the bladder?
It was a bladder. It was really
Okay.
towards the rectum, and I was like, that no wonder why she couldn't bowl very well.
Yeah.
Maybe the foal like pushed it forward, which
But I could have pushed that around too, like, because I push all that stuff around when I'm trying to get to the uterus and get to be able to cut all that out and get to the end of the cervix and stuff like that. So I might have mushed it
could be.
around a bit. Yeah. So I don't know if I'm gonna
They
say
all
that
look
that was
different though.
displaced.
They've
Yeah.
they've looked like dehydrated apricots. Other things, I'm like, this is so weird.
Well, when they do go down, they usually defecate and urinate, so they would be empty, most of them.
They would be
I've had some that weren't.
not weird.
So yeah. Um, but yeah, this year's gonna be huge. Like I don't even have everything that I'm doing on the website yet
I cannot
because
believe that. And we talked about you slowing down.
yeah, I know. Well,
You
I'm slowing
slowed
down
down in
working.
the
I'm slowing down working on horses. I'm just doing more of this.
well, it's
Hey, why not? If I can just work half the year, that would be lovely.
well, that Diane and I agree. We were like, it's got a good thing going. Like, why
Yeah.
not? Just
You
do
know, and
the
I'll keep going as long as I'm not getting burnt out by it because it is really emotional. Um, but and as long as people are still interested and they want to come and they want to learn. And I mean, it has been such a humbling experience because I've just been blown away by the people that come and the reactions of a lot of the people, and I've had every spectrum. I've had, horse owners, trainers, saddle fitters, farriers, mostly body workers. That's the vast majority of people that come. But I've had veterinarians, I've had it's just been amazing to me that I've had dentists,
you've had
it's just
barefoot
been really
trimmers.
amazing.
Yeah.
Yep, a lot of barefoot trimmers. Yep.
Yeah.
So it's been really amazing to me, and it's really cool when you have all those people there because you can bounce ideas off of people and really get an incredible conversation going, and
Yeah.
it's really fun. And that's what I love about the dissections too is I try really hard not to make it all about me, and like I try to draw people in and have conversations, and um, you know, when people ask questions, I ask questions back, like I try to get them to answer their own question.
Yeah.
And so it's kind of fun.
It's so in inspiring because you just understand the misery of these horses. And
Yeah.
and I can't even imagine that 4-year-old and what it went through, and the self-harm, the potential for harming others. And who would have ever known that if you didn't run those classes?
Right.
Like nobody would
Yep.
have understood that horse's story and how
Right.
genuinely painful she was in.
She was. She really was.
You
Um,
probably
but I
that was
think,
the greatest gift to her.
oh, it for sure was. It really was. Because I think it terrified her. It not only hurt, but it terrified her. Like she didn't know what was happening to her. Like
Right.
something was biting her. Something was, I mean, it had to be. I know if I was a horse, it would be terrifying.
Right.
So I could totally understand.
How would you be able to express that without, like, draw attention to yourself that you
Right.
need help, but not just be labeled crazy?
Yep. Exactly.
Yeah.
Um, but yeah, I think I did 8 or 9 this fall. And then I have, I think another 8. So I think maybe 16 this year. I think I have another 8 next spring.
That's insane. And what's the cost to attend this year?
So as of January 1st, they're going up to 725.
Oh,
Because I actually have decided to hire an assistant
yay.
that is going to travel with me to all of them. And
Who
and
is
so I
it?
have to pay their expenses. Actually, there's 3 different people. So they're gonna, because not the one person that I wanted couldn't make it to all of them. So I was like, well, maybe it's better to have a couple different people that they can all cover them. And and then maybe they're kind of geographically spread out too. So like one's here in Texas with me, one's up in Wisconsin, and the other is in New England. And so, um, yeah, well, so I raised the price a little bit so that I could pay that person and pay their expenses. And then I have somebody reliable that I know knows what's happening, and they're oftentimes ahead of me in the game and go into the next step. And because they know where I'm going next, and they're already prepping the next thing. And so
Oh,
it's going to work out good.
excellent.
So
That's so
yeah.
exciting.
And I still think it's really reasonable. It's kind of weird, this money game. Like, I wish I was really independently wealthy and I could just do them for free, but that doesn't happen. But I've had so many people at the end go, God, Lori, you're not charging anywhere near enough money for this.
It's
And then I have
brutal
other
how
people that
fast those
say, I
3 days.
can't do it because it's too expensive. And I'm like, what?
And if
I
you're a
mean,
horse professional, you write it off on your tax.
yeah, yeah, for sure.
Yeah,
As education, yeah, for sure.
absolutely. I wrote off all mine.
And we were talking before everybody got on that it, it's it is a must, I think, for everybody. Especially if you're a body worker, to be able to put your hands on this stuff and move things around and feel things and learn it in a way that's not in a book. It's just off the charts. So there's just no other way to honestly learn it. You can't get all of this from a book. And then the fascia aspect
The
is just,
fact,
oh my God, the fascia is just the layers upon layers upon layers, and how everything interconnects. And there, what you think, it's funny that everybody says, oh, well, it's all connected. Well, it truly is. And when you can really see that and feel it and be in one area and pull on some fascia and watch something move all the way at the other end of the horse, like
it's
that's just
mind blowing.
mind boggling.
Yeah,
Yeah.
it really is.
And you can't get that from a book.
No,
You just can't. You have to touch it and feel it and move it. And it is hard. And it's emotional. It's emotional because you'll see things. And I have people that have walked outside and just had a good cry because it hit them that hard.
yeah.
And that's quite okay. Like I've had those situations. I had one dissection that last year that it was a really small dissection. There was only 6 of us. Um, and I didn't have an assistant for that one. So I was prepping the horse that morning all by myself. And again, it was a young horse. I think he was 9. And he was just so broken. And I just lost it. I was in the tent with them all by myself, and I just lost it. I was just bawling my head off because, he shouldn't have been there. He
I
shouldn't have been on
know.
my table.
I
And he was doing his best. And I don't, some of the stuff that we found OCDs, huge OCD lesions in both stifles. Like, I'm just surprised that horse didn't kill somebody because he had to have been, and he was a jumper.
oh.
And
And why
so,
didn't some vet find that? That's so frustrating if that
it
big.
was right in the top of the tibias. It was in the center, in the top of the
But you would
tibia.
never see
And
it.
so I don't know if they could have seen it in an MRI, absolutely. But in x-rays, I don't know. So, I'm sure they looked for it. I'm sure that they looked to try to figure out what was up with this horse. But it was a university horse, and they didn't have a ton of money to do the things that they needed to do. And, MRIs are not cheap.
Right.
And so actually the person who donated him was a student, and she was an unbelievable soul. She bought this horse from the university, hoping maybe she could rehabilitate him. Like, she just wanted to turn him out and let him be a horse for a while. And then she tried to bring him back, and he just couldn't. And she made the really hard decision to donate him so others could learn from him. She blew me away.
Wow.
She absolutely blew me away. So, um, yeah, there's a lot of situations like that happen. And
And
but
then,
it's growing, and it's this year has just blown me away because I have a couple of them coming up that are going to be private ones for certain kinds of different groups. One of them that I'll share um, is a group of trainers. They're hunter jumper trainers.
I love that. They really
And the
need
person that's
that.
organizing it came to one of the dissections up in Wisconsin, and it just affected her so profoundly. She was like, I want others that I work with in this industry to see this and to experience this. They have to know this stuff. And she was so devastated because she was like, oh my God, going through the dissection, just all these horses kept going through my mind over my lifetime that I thought, oh, that was probably what was wrong with that one. And that was, and she was she was killing herself, like, feeling bad that she didn't figure it out. But, some things you just won't figure out. That's until they're on the table,
Yeah. Hopefully we
unfortunately.
can stop that. Hopefully we can
Yeah.
learn.
Well, my mission, I think the place that we need to get to is that you have a dissection full of judges.
Yeah.
There's where we'll make the change.
Well, you
We
have,
stop rewarding this bad posture and this bad movement.
right.
Maybe we'll get someplace.
I agree. And you could probably offer it in at those associations
Yeah,
like
possibly.
APHA, AQHA. You could probably make
We'll
it,
get there someday, maybe.
yeah, you might be able to make it a requirement for judging. Like you could move towards that.
Yeah.
You never know. We
I
could,
might end up dead.
no, no. The good old boys club. Yeah.
Yeah, that might not work out so well.
You
Have
don't
to be
show, so
careful.
you're okay.
I don't show.
Yeah, so you're
Absolutely
the
not.
perfect one for this. And you guys, Lori only does it fall to early spring because we need the cooler weather for preservation of the animals. They get a little stinky.
Yeah.
Yeah. So if you guys are interested in this, now's your time. She has some signups available. She was all sold out, and then she added like 10 more dissections.
Well, there's like 2 spots left for Minnesota in a couple weeks.
Okay.
Um, Other than that, the fall is completely sold out.
And
Um,
and then
but then it starts in January. There's 2 in January. I think there's 3 in February. March is wide open. I don't have anything for March yet.
okay.
Um, and then I have 3 in April.
So you're home in January or Vashon?
Yes, exactly. There's one in Texas in January and Vashon Island in January
I'm going to tell you
up in
guys,
Washington.
Vashon was cold, but it was
Yeah,
beautiful. Yeah, it was fun hanging out on the
it
island.
wasn't cool.
It
You're
was
so
cold
funny.
for me.
Yeah.
Well, California was even cold, and that was right down my street. They literally
Yeah, well, that was really
dissected.
rainy and cold though.
Yeah,
That was a rainy weekend.
it was.
That was cold
If you
for
need
sure.
a horse in California, I don't have a facility, I don't think, to host one, but I have a horse you could dissect.
We'll
Yeah,
just find a place.
yeah.
I'm sure there's plenty of people that would do it.
I think actually one of my girlfriends would be interested. She talks to me all the time about your class. She's always like, "So, what about this?" I'm like, "Just go. Just
Yeah,
go."
yeah, that's what I say to people. Um, you just I think people think it's going to be really gory and um
There's
it's
no
really
blood.
not. It's
Yeah,
yeah, there's definitely blood, but it's not gory. Like the body is just so stunning. The body is just beautiful. And so it is just so fascinating to see. And we do some really cool stuff in them. Like, we look at the relationship between the hind limb and the head and how all that moves. And that's the first thing we do on the first day is put a bit in their mouth and in the horse's mouth and move a hind limb, and see if you can feel it in that bit, and then put pressure on that bit. Can you feel it in the hind limb? And then try to put the horse behind the vertical, and can you feel what it does to the motion of that hind limb? It's that right there, it just sets up the whole weekend. Like you don't even understand um how it affects the motion of the horse.
yeah.
And so to be able to, for each person to be able to feel that, and then doing the locking mechanism, I think that's a
I was
that's
just
a
gonna say that
crowd favorite.
the stay
Everybody loves
apparatus
doing that.
was
Yeah.
really surprising to me.
Yeah. Yeah.
Absolutely. Yeah. I posted it on TikTok and they tried to ban me. They were like, "You are posting really violent."
That's interesting because I think it was Instagram. One of the girls that came here a couple of years ago in Texas posted on Instagram, and it went crazy, like 2.5 million views or something. And it became, I don't know anything about Instagram, but I guess it became the video of the day or something. And
That's
it goes out to every Instagram follower. And so you can click on it and watch it if you want or not. And well, my daughter-in-law um started watching it, and she was like, "What is this?" And I'm talking in the background on the video, and my son heard my voice and was like, "What are you watching? That's Lori's voice." And she's like, "I'm watching some dissection video." But we were doing the stay apparatus, and it was so funny. And he texted me and said, "Hey, how did you put this video out?" I'm like, "What video?"
he
And he
didn't even
said,
know.
"You're viral, girl. You're out there." And so yeah, it was pretty crazy.
Yeah, it
So
is. So the stay apparatus is amazing. I also was
yeah,
blown away by the sesamoid bones. So the
yeah,
sesamoid bones weren't anything what I thought they were. And I thought I was really good at sesamoid bones. And I was like, oh, ah. And then the
that's
sternum.
funny.
I mean, like, I cannot talk enough about all of this. The
Yeah,
sternum just being like a reverse vertebrae of like literally
yeah,
five, like,
yeah. They're sternebrae. It's not one bone.
yeah,
There's cartilage in between. There's usually five. Maybe some horses have six, but usually five.
that rocked my
Yeah, but
boat.
it truly is the keel on the boat. I mean, it really is.
And it looks like it.
It does look like a keel on a boat. It really does. And then I think it's so funny because I've kind of learned as I've gone along on so many of the aspects, and um if I find things that I don't know what it is, I'll take a video or pictures or whatever, and I share them with Ivana Ruddick, and she's just so wonderful to me, and she always answers me, and she'll text me back or send me more information. And I'll never forget the first time I actually saw what the xiphoid process looks like. And you think it's just like this little notch or something, and it's actually a plate. It's this cartilaginous plate, fibrocartilage plate. And it's the first time I saw it, I was like, oh my God, what is this? I took a picture and sent it to her, and she just laughs at me and, oh, Lorre, you're so silly. Yeah, it's pretty funny. Um, but she's so good to me, and she answers all my questions. And so it's nice to have people like that in your corner.
Absolutely. It's
Yeah.
it's taken an army.
Yes.
Your journey as a trail rider to a basic course. So you learn
Yeah.
a basic myofascial release course.
Yeah, that's how I got started. When I moved to Texas, I knew I wanted to do something with horses. I just wasn't sure what. And I thought for sure I was gonna maybe have a used tack store or something. That's what I was leaning towards. And where we were building a house when we moved down here, so we were boarding our horses for a little while. And the place that I was boarding, she had a little myofascial class with this gentleman named Willie Ellis. And he was a big teddy bear. He was about 6'5" and just this big dude. And the horses just melted. They loved him. And so he taught this myofascial course, and I took that and I started working on my own horses. And the owner of the barn was like, God, Laura, you're really good at this. Like, can you work on one of my horses? And I was like, no. And I just wanted to work on my horses. And she just kept poking me and pushing me. And then I went and took a Masterson method weekend class, and I fell in love with Masterson method and went and did the whole shebang, became certified, and then became an instructor for them. And I was a mentor and a coach. And that's an incredible organization and a wonderful form of body work. And so then I ended up at the Vlugen Institute and became an osteopath. And that's like drinking from a fire hose. Like, it's the education is off the charts. And boy, it's like going to a graduate program. Like, you're on your own to learn and study. And he just opens the fire hydrant and drenches you down when you're there. And then you got to go home and learn and study and practice. And then from there, I just kept going. It just fascinated me.
Totally cool. So if you guys want to sign up, if you're interested, you go to Trinity Equine Services,
.com. Yep.
And
Yep.
you can
go to the events page, and then there's a tab for dissections, and it has all the dates there.
Yeah.
And it's really easy to register. And
absolutely. And let me know if you guys are going. I'd love to know. And if you guys want to do iridology the day before, Lorre, what do you think?
Yeah, I mean, whenever you guys can come and do any of that, I think it's fantastic.
You've really,
for sure.
Us. It has rocked our world. Absolutely. Yeah. So I look forward.
And yours, mine.
Yay!
It's really been a great experience getting to know both of you and learning some of this and just helping make the connections. It's been fascinating. I thought, oh, this is going to be craziness. This is going to be some voodoo stuff. And it was unbelievable.
I was really so happy. I think spring was our best one, actually.
Yeah. I think so too.
Disappointed after that. I'm like, oh, but
Paris, what was it?
Paris.
What was the horse? Paris. No, the other. Did you stay for the other one? You didn't stay for the other one.
No.
Paris was pretty interesting too.
Paris, we had a lot of pathology. That congestive heart failure was
on
irises, and then he had that pyloric cancer that marked.
Yeah, that's right.
Yeah.
Yep.
I remember him dearly. And then Sarah had that.
We're gonna dig him up, I think, in January.
Oh, wow.
And put him together.
So you guys, you don't really get to see like the spine. when we do the dissection because it's covered with so much muscle. I have a foster dog that's eating everything. He's
Oh
grabbing
no.
everything on the ground and he's like picking it up. I'm like, oh, I'm like keep blanking myself out and grabbing things out of his mouth and coming back. But
well, now at least we know where you're going when you're
yeah,
doing that.
yeah, I'm like, hold on, I gotta leave for a minute. Yeah,
You're funny.
he has a business card in his mouth right now.
Oh no.
Out of his mouth.
Well, that at least will come out the other end.
Yeah, it will, but this was also
Yeah,
in his mouth.
that wouldn't be a good one to come out the
He's
other end.
never been an inanimate object eater until right now, of course. Well,
He wants your attention.
yes, he gets
But yeah, so that's going to be a fun one in January. I'm going to go early, and Lola and a few other people, we're going to put Paris's skeleton together.
Oh, I might want to
and then I'm going to stay for the dissection.
That's so interesting because I bet that horse had a lot of like lower
It'll be fun to
cervical
see
issues.
I don't get to see them afterwards. Like I don't get to recover them afterwards. When people do, compost their bones and stuff.
Yeah.
So this will be fun to be able to see.
Well, and
afterwards.
our iridology continues on that.
Yeah, it could, for sure.
Because we have all those notes on it. So there.
Yep.
Yeah. Hey, let's open the gallery. You guys have any questions for her? Jump in there and ask. Mary, do you have any questions? Because I know you always do.
I'm so sorry. I had to come super duper late. I've actually messaged you and Facebook, Poppy. My horses, all three, had like a super reaction to a new fly spray. So I was bathing horses and I am late joining, but I'm going to watch back. I'm so glad to have you tonight. And sorry, I don't have any questions, Poppy. You can like write a note on that, right?
Did you do a charcoal bath on your horses?
I did a neem bath. I don't have charcoal in that quantity.
So activated charcoal, a little goes a long way. Shake it up and rub it all over them.
Oh, well, I do have some because I do keep it in the barn.
Yeah,
that's
it
helpful.
Will suck the fly spray right off of them.
Super.
Wow.
Yeah.
Sorry, but I am going to watch back because I'm bummed. Usually we go a little late, so I thought if I joined late, I would still get content.
Yeah.
Yeah.
Christine, do you have any questions?
No, but I find it so interesting to listen. It's like I was saying, it's like I can't even stick a needle in a horse neck. But if the horse has a wound, if I have to shove my hand somewhere, I'll do it. I'm okay. Just a needle. Forget it.
No.
I can't. I remember my vet holding my hand and then they're I just can't.
Yeah, I understand that. I totally understand that. I don't want to ever give my dog shots either.
So. I can't do dogs. Well, I can, but I don't like to do dogs. The horses don't bother me, but the dogs, I don't know. Mm-hmm.
I have some shocky horses, so I'd rather somebody else do it. I'm like, I don't want to be the bad person. Yeah, I don't want them to hate me. Carol, any comments or questions?
Well, Carol's been to one.
Oh, that's awesome.
Yeah.
Carol's hanging out learning the iridology. So Carol, you could
fantastic.
Do the iridology next time.
Yeah. Yep. Yeah, Carol was with us up in Michigan, right?
Yeah.
Was it in Michigan?
Yep. It was up in Michigan to Wajak.
Lori, the way you can remember names is insane. I aspired to that. That's so crazy.
Well, then I leave there for the weekend and then it's spotty after that.
It's still impressive.
It's my game for the whole weekend to try to get everybody's name for sure. Yeah.
Cheyenne, do you have any parting words?
Well, her memory is amazing. It's impeccable.
It's impeccable.
I don't know how she does it.
I know.
I think
talked about it.
Yeah, there's a couple literal life-changing things you've taught me. And first was that thyroid. If you'll remember when I came to you with the iridology, when you were first like, is this voodoo? And I said, I don't remember now if it was the right or the left, but it only showed in one side. And you're like, do you know what the thyroid looks like? And I said, nope, I don't.
And I thought it was a butterfly like human.
Yeah, because like on
Nope.
ours, and then she explained to us it's two different ones. And then you dug in and got each one, and the eye had nailed it on which one was incorrect. And that was huge for me.
Yeah.
That was huge
Yep.
for me to see it in the iris and see it in real life. And then, but the life-changing thing, I remember what we were saying. You know how those big moments in your life, you remember where you were, who was around you, what you were dressed in, you know? And we walked out to get the picture after Thomison had been on the table a full day, and the eye was different. And we started walking away like, what? And you said, let's go back and maybe we messed up. Let's take it again. I'm like, yeah, we must have messed up. Let's take it again. And to see that big left hind leg marker that wasn't previous, but after you remove the left hind leg was like
That's
that
so
still messed me up,
shocking, you guys.
because
Yeah.
I still, I was so happy to have that moment with you, you know, like we did that. That
Yep.
was so cool.
And the one thing that stands out for me about that one was the hyoid. Do you remember how crooked his hyoid was?
Yes. And I was so excited that it showed.
Yeah, you were
That's
giddy.
I
Yeah.
was celebrating, and she's like, but this poor horse. And I'm like, I know, but the eye showed it.
I know.
Yeah.
But I guess my fun memory of Lorre is trying to get her mouth to clean up so I can keep recording and
Yeah.
remind like, Lorre, quit, so I can record.
Uh-oh. Was I dropping some F-bombs?
Oh, slightly, yes.
Yeah,
So we kept
Especially-
telling her, we're gonna have to get you a cuss jar.
I know. Well, and especially when things are going wrong, like when you're seeing things with the horse that are really making me mad.
Yeah.
Like-
Well, you are an excellent teacher. Your
Oh, thank
teaching
you.
capability is top tier.
Oh,
Anyone
thank you.
thinking of going, do it. It is worth every penny. She's
Thank you.
amazing.
Your-
Lorre is amazing.
Your horse career will thank you. It will
Yeah.
change.
Totally
Yes.
agree.
Yeah, it
I
will.
absolutely agree.
Yeah.
You know,
She
and it's
knows
just a
things that-
fun, yeah, it's just a fun experience. I shouldn't say it's fun. That's probably
Well,
not the right word.
It is though.
it's-
It is. It is fun.
Because I try so hard to get everybody that's there involved. Like,
Yeah.
even the people that want to be little mousies in the back of the crowd, like I try really hard to get them all involved so that you make sure that you get the whole experience. Like you get to touch everything. And if you're not, like if you want to be a mouse because it's overwhelming you, I let you be a mouse. Like I won't make people do things, but I don't want them to miss out on the experience either.
Right.
And for me, it's really fun to have a discussion. Like
Yeah.
I mean, like Carol and I had some really deep discussions. Like she came with things she wanted to see. And so we just went exploring and tried to find the things she wanted to see. And, you know, we had some great discussions. So like, I thrive on that. And then to see, I think my favorite part is the aha moments, like when things make sense to people and they start to put the connections together and you can see the light bulbs going on. Like that's what keeps me doing it,
That's
is
so,
when people are making those connections.
yeah.
Because you know they're going to do better for the horses, you
Yeah.
know?
It changed our lives.
So,
You did. And I
Yeah.
thank you for it. I appreciate you.
oh, I this is right back at you.
Right on.
Yep, it's been fun.
You guys let us know if you have any other questions. Reach out to Lorre, Trinity Equine Services. You got to do it. You got to do it
Yeah.
at least once because it will make you have better compassion and understanding. You'll put your hands on your horse and realize where things are and how they feel and where they shouldn't be. So, yeah. Thank you, Lorre, for your time today. And
Yeah,
Hostler's site, what is that?
yeah. Veterinarygcompendium.com.
Okay. And you
Yeah,
guys can
really good stuff.
you can jump on their email list and they will send you emails of their upcoming events. So definitely.
Yeah,
And you
really good information. So, and I sit on his advisory board, so we come up with the content and we debate it and help him put together his webinars. His webinars are super, I don't want to say geeky, but like super educational, really high level education. But the wonderful, I personally think they're really reasonably priced. All of his webinars are $55, but you have it for life.
Oh, that's
And
great.
so if you are overwhelmed by the topic and it's, his information's going over your head, you can go back and watch it 100 times if you want to, and study it and, take notes and then go learn more. And then his community gatherings are $20 a person. And they're more of a conversation like this. Like he usually has a guest host and they just have a conversation. Like the next one, the end of this month, the 25th, I think it is, he's doing a presentation on research papers and how do we know it's a good research paper, and what are you looking for in the paper to figure out if it's a good paper, who's funding it, like who's doing the research, what, is there a control group, like all the little things that make a good paper. Is it just a paper that's written as a review, so they've looked at 100 papers and then wrote their paper based on the results of 100 different papers,
Right.
And he goes through what's required for the whole peer review process, and his advisory board are going to be the guest hosts. So he's going to do a little presentation and then we're going to ask him questions about research papers.
Awesome.
So it'll be a good one, I think.
Yeah. In fact,
because I hate reading research papers.
I love them.
I hate research. I read the abstract and I read the conclusion.
Yeah, and then I fill it in if I like the graph.
If you have to, yeah. The graphs are good. The graphs are really good because that helps you put the pieces together. But
and I'm trying to make my own research paper, but I need a control group. So I have my UC Davis guidance counselor, and so
fantastic.
Yeah, so I have to get a whole group of control people, and I thought I was going to have to pay for that out of pocket, but I think she's going to teach me how to write a grant. So
nice.
Yeah, it's new territory for me.
Yeah, it would be for me too. I can't.
Yeah, so
it's just not my forte.
Our EPM study with iridology, but the cardiac marker seems so accurate. We could probably do each individual area with the iridology and even systemic toxicity. So yeah.
And I think I really think I just need to start taking pictures the day before too. That's got to be part of my evaluation. And
absolutely.
And then send them to you.
Because of you, the visceral fat became a really big deal to me. And so yeah, I've been tracking visceral fat in the
think about how bad that is in people.
That one horse we did had like 3 inches of visceral fat between heart.
Well, there's always a lot of abdominal fat, but it depends on the quality of that fat. Like, is it hard and
bright yellow,
or is it bright yellow, or is it? I've had one that it was white. Or is it really greasy? There was one horse that was super oily fat. Yeah. So there's all different things that are going on in that aspect. So yeah, but visceral fat is not, it's supposed to be there, but within reason. It's there for lubrication and protection. And but when you have excess, you're getting into some serious health issues.
Yeah. Absolutely. So amazing. Yeah, we're tracking obese cats and dogs, and you can see it in the iris as visceral fat.
Wow.
Yeah.
Wow.
Not much with the horses, I don't think.
You're not seeing that in the horses?
Not as much. But we need more eyes. We need more dissections to prove this.
All right. I'm gonna just have to start.
Dog and cat. But some of your horses were really fat on the inside where they didn't look fat on the outside.
I've had several of them. I had one that was like, you could see it, all the bones. And we opened him up and he was an excessive amount of fat.
So see, if I'm
And
here
this-
long enough, I'll have questions.
I knew it.
So,
Yeah.
so if you're seeing that excessive visceral fat, but on the outside, the horse doesn't look, excessively obese, what other organs are showing up in correlation with that have some level of functionality problems, like along with the fat that's way over what it should be?
Well, what we came to the conclusion with this horse that we dissected, he was hypermobile, like super hypermobile. And one of the people that was in the dissection had Ehlers-Danlos Syndrome.
Yeah.
And so she was a little heavy, and she had a hard time with her weight her whole life, and she was really hypermobile. And the doctors believe that that can be sometimes a component for that disease, not for all of them, because there's some people that have Ehlers-Danlos that are super thin. But it can be a component for some people because they're actually laying down excessive fat to try to stabilize their bodies.
Mm-hmm.
And so we think that that was what was going on with this particular horse that we dissected, because he was crazy. Like, that's why he got donated, because he was so unstable that
poor guy.
he had fallen a couple times with the owner.
Mm-hmm.
So and they had tested him for everything. They had x-rayed his neck, they had tested him for EPM, they had tested him for all kinds of neurological problems and wobblers and everything, and nothing. So it was kind of interesting. But you get a lot of metabolic issues when you have that much visceral fat. So you have these horses. I honestly think equine metabolic syndrome is an epidemic. We feed our horses so wrong and so badly.
And the
that
vaccines and the over-vaccinations.
Hostler just did a community gathering last month with a veterinarian that they talked about vaccinating. It was a very good community gathering. You'd enjoy it.
Okay.
Is it recorded?
Yep.
Yeah.
Yep. You can pay. It's $20 and it's yours for life.
Oh, it's that website you were talking about.
Yep.
Can you say it
Yep.
one more time? I'm so sorry.
Yeah, it's Veterinary Compendium.
Thank you.
And it was very interesting conversation. We asked her a lot of questions about over-vaccination and why are they doing and it basically kind of came down to that the studies that they do, they have to put like an efficacy period on the vaccine. And so if they don't do long-term studies, which are very expensive,
which they don't do,
they don't, they'll say, it could last 6 months to a year, or it could last, like tetanus, they'll say 10 years. But if they don't put that parameter on it, then, they have to do that to get it approved. And so then if it only says it's good for a year, then we have to vaccinate every year.
Right.
And then
so the vet
issues.
Yeah. The vet they had on has started doing a lot of titers. And to save, she was really cool. Her name's Anne-Marie Hancock. She's also an EDO. She went to the Vlugen too.
Okay.
But she, she spreads them out for her owners. So, because the titers aren't cheap, so, she'll say, let's do these two vaccines. Let's test for this disease this year, these two. And then next year we'll test for this, and that way it's not astronomical for the owners. And so I thought that was a really good way to do it. And
I love that.
And get that information. And she said a lot of people in her area are a lot of the shows and stuff are actually taking the titers.
Oh, good. I'm so thrilled because I have so many
Yep.
clients whose horses have had bad reactions and they
Yep.
keep vaccinating. I'm like, no, just get a titer report. And they're like, they won't
Yeah.
take it. So
Yep. So I don't know if everybody's doing that, but she lives in Virginia and she said a lot of the places are starting to respect that and
excellent.
they'll take the
And
titers. Yeah.
yeah,
So
so much harm to their endocrine system,
yeah.
immune system.
I mean, we don't do that in people.
No,
Like, I mean, like I think by the time you're maybe 16, you've had all your vaccines. You don't have to have another vaccine the rest of your life unless you're going someplace really dangerous and you need to boost or something.
yeah,
And then of course they'll try to get you to do a COVID or a flu vaccine.
flu.
But other than that, you don't ever get a vaccine again. So why do we vaccinate our animals year after, and now sometimes every 6 months?
I know. For those show horses,
Yeah.
Dr. Jean Dodds, and I think Dr. Judy Morgan were in on this. They tracked rabies vaccine longevity in dogs. And I think they got to the 7-year point, and at the 5-year point, it actually spiked their titers.
Yeah.
Yeah.
There's a couple of veterinarians that, and I forget, she talks about them in the community gathering, but they believe that there's actually lifetime immunity.
So my vet did a webinar on titering, and because she was in support of titering, she did a webinar. Now, I didn't ask her like who hosted it, who paid for it, but that would be interesting. And they had done a study. I don't know how many horses, so I don't know the efficacy of the study and all that. They done a study control group, right? They so let's see, they didn't, I don't remember if they got or they didn't get vaccines. Other group was titered and not vaccinated for the things they showed titers at protective levels, and then expose the animals, which we're still doing that. Expose the animals to the whatever the infections. She said the horses with protective titers still were sick and sicker. They must have vaccinated the horses than the horses that were vaccinated in their study. And it just throws me because she was all on board with titers. Now she's all weird. I mean, Poppy, I'm not vaccinating mine anymore. I'm like done. I'm doing no-sodes. And my vet looks at me like I'm crazy, but I'm doing the thing. And so I don't know I guess I should ask her who did the study and whatever, who funded the webinar, because right. I mean, there's a lot to be lost in big pharma also.
Yeah, and she could have had a gun held to her head on her license. So
Yep.
we don't really know if she was threatened like Dr. Margot Roman. So yeah, there's a pioneering dog vet that just had her license revoked.
Really?
Yeah.
Is she
Wow.
still or is she finalized, Poppy, or is she still in court?
I think she's still trying to debate it.
Appeal it maybe or something.
Yeah.
That's really horrific.
Yeah. It is. So anyway, on that happy note.
Yeah.
Sorry.
No, don't be.
It's all your fault.
So,
I mean, you all were talking about dissecting dead animals, so
yeah.
And we didn't get kicked off Facebook. We're still live. So that's amazing. We didn't show any graphic photos.
You know what's really interesting? So I did an ad on Facebook not too long ago, and I put the picture of the face, with the labels on it and stuff. And Facebook didn't black it out, like they didn't blur it, which I was really surprised. I thought they would.
Yeah.
And I got so many trolls, like saying really bad stuff, like, this is horrible, you should never put this on here, kids might see this, and I was a vet tech and I wouldn't even show stuff like this, and I mean, I was like, oh, just stop. Just stop.
Did you get conversions? Did you get people purchasing?
I don't think so. I think I did fine without it. It was like doing the boost stuff.
Yeah.
And so there were people that didn't know me or didn't know anything about me. And of course, they feel like they have to say something.
Right.
So I think I do just fine just doing it on my page. And then, the people hosting do it on their page. And then I have so many followers and then they repost it. And I'm not doing this boost stuff anymore because you just get these trolls. It's really,
Yeah, I used to run ads for my iridology classes, and Cheyenne caught the first one. That's how we met. Is I had made this iridology masterclass with the original Mercedes Colburn, and people were saying that's the devil's work and stuff like that. And Cheyenne jumped in there and defended me, and we've been friends ever since.
that's awesome.
Yeah.
Yep.
That's how we met, actually. She was fighting the Facebook ad for me.
That's awesome.
Right on. Everybody needs a
She's a good Texas girl, that's why.
She is. You don't mess with Texas.
Don't mess with Texas.
Right. You guys have a wonderful week. Next week, I have no idea what we're doing. I'm at a loss. Maybe we'll do a pet prayer session or something like that. Let me know what you guys want. And the clinical iridology dog and cat course starts tomorrow. If you guys wanted to get in that and get certified as a clinical companion animal iridologist, it's tomorrow. So, all right. Take care, you guys. Have a wonderful week. But also, Lorre, you have an amazing winter. Hopefully I'll see you in January, and I'll give
Good
you
to see you, Lorre.
Yeah, you too, Sean.
Yeah, especially if that Texas is still open. I guess we all better sign up fast.
We better.
Especially
Texas is still open. You guys just call me just text me. Yeah. Don't sign up.
Okay. Thanks.
Okay. We'll
and
see
then
you
we'll figure it out.
I'll
Yeah,
try.
Cheyenne needs to get her kids going to
Yeah.
her kids are all professional horse people. I'm like, Cheyenne, stop.
Yeah.
Get those kids there.
All right, y'all.
Anyway, they drink a lot of coffee. So
me too. They're right up my alley.
Now we drink cinnamon tea because of Lorre.
That is true. I love that cinnamon tea.
Good, y'all.
That stuff is so good.
That's so funny. See, we're all about Scaples Viva and cinnamon tea now.
Yeah. Hey, whatever it takes.
Amen.
Make
Bye.
friends.